So this was regarding the correlation. Now coming to the McNemer test. So McNemer test is also, it is again a paired observation, but for which type of variable? Anyone? Any prior
Non-parametric.
non-parametric, it's okay, but like paired t-test is when the variable is
Continuous.
continuous, true. But here the variable is categorical. Like if you measure anemia in hemoglobin. So pre-post hemoglobin, if you are measuring, that is paired t-test. But if you are making categories, so chi-square opposite. How come chi-square opposite? Although there is a categorical, but can we say that it is a, yeah, paired categorical, true. It's a paired categorical. So again, this session will do some basic concepts, then research questions, assumptions, commands, and then summary. So characteristic of a McNemer test, like you said, that it is a non-parametric test for a paired nominal data, and you measure the change in the proportion for the paired data. So which is also, that's why it is also called as the McNemer chi-square test, because the test statistics has a chi-square distribution. So the type of research design which we have done for the paired t-test, similar pre-post study, or it can be pre-post study if there are changes over time without intervention, or if there are difference between the conditions. So this is again we have done in the paired t-test, like two values, blood pressure, but again here you are measuring the blood pressure not as a millimeter of mercury, but high and normal. So you have a category of this blood pressure. Please focus. It's the same which we have shown you in the paired t-test, but here we have categorized the systolic blood pressure as high versus normal. Then two different conditions like before workout, after workout, then two different sites, and then two different instruments. So we can measure the categorical variable on any like depression status, present or absent. So it can be like blood pressure or any other variable which is a categorical in nature. So the research question can be, you want to know whether there is any change in the proportion scores in paired observation. So it could be like whether there was a difference in proportion of BMI status, and it should have only two categories. You cannot have a 3 category of a BMI here for McNemer before and after a 6 weeks exercise program, because it comes in the option of contingency table. We'll see that. And then again, if you want to compare the pain score like moderate versus severe measured on a VAS before and after surgery, you can do that. Or is there any difference in proportion of passing in pre-university and university examination of an MBBS student? So in this all variable, what have we seen? That there is a categorical variable, and we are seeing the change in proportion of that categorical variable in a pre-post study. So the appropriate statistical test for such type and such type of study design is also known as the pre-post study. And this we apply this McNemer test of assumption. This McNemer test. The assumption is that there is one dependent variable, but that is not continuous. That is a dichotomous categorical. The independent variable can be a two intervention, can be two related group or a matched pair. So the null hypothesis is that the population proportion difference between the paired value is equal to 0. And alternate hypothesis says that the population proportion difference between the paired value is not equal to 0. So now let's see its demo. So I'll just read the question. So this is the question, like I have to. So at the time of discharge, like you have done a nutritional counseling session to all the patients to improve their hemoglobin level. Their hemoglobin was measured before the counseling and 3 months after the counseling. And you want to see whether there is any significant change in the anemia status of the patient before and after counseling. So you have to compare the proportion of pre-counseling anemia status versus post-counseling anemia status. So what will you do? You go to, I'll again open this. So I need to import data because that is there as a SPSS sheet. So maybe I'll go to Jamovi, open. And I am importing a SPSS sheet here. So this is the variable. You can see this is the hemoglobin, this one. And then we have categorized as a baseline. And then there is a hemoglobin after the intervention. And then this we have categorized as a post-intervention. So you have to make a 2x2 table. So what will you do? You click on this McNemer. And now what to enter in rows and what to enter in column. So pre-intervention, just remember, if you can, this is your anemia baseline. So enter anemia baseline in rows and anemia post in the column. And there you will see this value of McNemer. So McNemer is significant. So now how to interpret this? In this case, McNemer test is also known as the test of binomial proportion. So you will have to see, test of marginal proportion, not binomial. So we calculate the marginal proportion. So remember, in the rows, we have entered anemia baseline. So this is the anemia baseline. So how many of them are anemic initially? So at the baseline, if you see, there were 19 people who were anemic initially. And after this post is the column. So how many of them were anemic? So this present is 12. Okay, so they see these two values. So this 19 is the anemic. In the initial, during the initial time, and this 12 is anemic after the intervention because that is in the column. So how will you calculate the percentages? So it will be 19 by 58 and 19 by 193 and 12 by 193. That we did in the interpretation. If you see this interpretation, so you can see here that on recruitment, how many of them were anemic? 39 plus 9, because anemia is present in 39 plus 19. So 58. So this 58 by total number, it is the 30%. Whereas later it is 12 plus 19 who are anemic, that is 16%. So that's why we call it as a test of marginal proportion, because initially these number of people were anemic. But later after intervention, these were anemic. So actually you are calculating the marginal proportion. Marginal means this is the marginal initial row, it was the pre-test, and post-test is the column. So these many numbers were anemic afterwards, and these numbers were anemic before. So percentage you have to calculate it. So 39 plus 19 divided by total number, that will be your percentage. So there is a decrease in how much percentage? Approximately 14%. So you can write it, and then which was significant, you can write the p-value. So that is how we write the interpretation. So this is the McNemer test. So if it is okay, you can, Akanksha, you can open the breakout room.